Good morning. We're going to begin the public hearing for Children's. This meeting will be live streamed on YouTube and is being recorded. Please have your mic muted if you're not speaking. Please do not use the chat function on Zoom as it's a public hearing and the chat is subject to FOIA. For members and staff, please raise your hand on Zoom by clicking reactions and then raise hand to be recognized. If you are in person, please always use your microphone when speaking. Speakers who have signed up to testify have the option to testify in person or via Zoom. For those on Zoom, you'll be promoted to panelist as it gets close to your turn to testify. Please make sure to accept the invitation to be promoted to panelist so the clerk can admit you. Speakers are limited to 3 minutes of testimony. When your 3 minutes are up, the clerk will alert you and ask you to summarize your testimony. Thank you. So we will begin with Senator Martin Looney, who I believe is online. Oh, so sorry. Hang on. We're going to say hello first. Hello. Good morning. It's Friday. If it feels like Groundhog Day, it's because it is. Okay. Because most of us were all together on Tuesday. So good morning, and I would like to ask the ranking members and to please say hello.
Good morning, everybody. It's Lisa Seminara. Nice to see you all again. Welcome to the children's hearing, and I look forward to hearing everything that everybody has to say. Thank you so much for your time and coming today.
Okay, thank you. It's okay. Representative Dauphinais.
Good morning, and thank you, Senator. Good morning, everyone. We are looking forward to getting started. It is Friday, so let's move this right along. Thank you.
Thank you very much. And I believe Senator Looney, you are first to speak. Thank you.
Great. Good morning. Good morning, Senator Marr, Representative Lenahan, members of the Children's Committee. I'm Martin Looney, State Senator for the 11th District, representing New Haven and Hamden. And I'd like to express my strong support for Senate Bill 2, an act concerning the mental, physical, and emotional wellness of children. And this bill is really a comprehensive set of policies that are designed to support children, their families, and professionals who work with them. It is carrying on in the spirit of the major bills from last year's session, Senate Bill 1, Senate Bill 2, and House Bill 5001, all of which were critically important in focusing in on the needs of young people, both in our educational system and also dealing with those who have psychological and social needs that require care beyond what's available to them in the school system. So the bill touches on several areas in the lives of Connecticut's children, one of which is enhancing the supports provided to professionals who work with children. Social workers in our state, as we know, perform a variety of services to help children. This bill works to make social work as a field more accessible, lowering licensure costs, and adding staffing in the licensure office. And the bill also entitles birth to 3 enrollees whose primary language is Spanish to a provider who speaks Spanish or to a translator to accompany their services. And we know that the language issue is often a barrier to effective treatment. The bill also establishes the Office of the Behavioral Health Advocate, which will support behavioral health providers and advocate for policies and laws that will enhance behavioral health care and work to improve the field. And finally, the bill directs DSS to hire temporary and part-time employees to enroll eligible children in Husky. Along the same lines, SB 2 seeks to address the mental health of children as well, and the bill asks the Commissioner of Social Services to amend the Medicaid state plan, if necessary, to reimburse for suicide risk assessments and mental health evaluations and services. And the Comprehensive Needs of Children Task Force has been developing exceptional reports on children and the services in our state for the past few years. And SB 2 asks that task force to investigate some of the short-term ARPA-funded efforts the General Assembly has proposed in the past few years and determine if the General Assembly should continue permanent funding structures for these initiatives. So the bill has this evaluative component as well. And finally, the bill asks the State Department of Education to grant funding for training behavioral health providers to identify and provide services for at-risk teenagers. And so I urge the committee to support and advance this bill as part of a comprehensive package of continued assistance to children in our state in this time of crisis, exacerbated by COVID. Thank you very much.
Thank you, Senator Looney. Do we have any questions? Seeing none, we appreciate your testimony today. Thank you.
Well, thank you so much. And good morning to everyone. And I think we've all recovered from the confusion on Tuesday when everything was shut down and we determined how dependent we are on the technology of the internet.
Without a question.
Thanks again.
Next, we will hear from Sarah Egan from the Office of Child Advocate.
Good morning to the committee on a Friday, and my name is Sarah Egan, and I run the state's Office of the Child Advocate. We're here to testify in support of several bills, and you have our written testimony, but I just wanted to highlight a couple of things from our testimony on Senate Bill 2. As we've testified before in this committee, we know that our children's mental health crisis remains ongoing, and that we have a lot of system building to do to address workforce deficits. This bill does talk about social workers and the items that Senator Looney just talked about. We wanted to highlight that need for Medicaid reimbursement for suicide screenings, as all data across the country and in Connecticut is telling us that children's suicidality is increasing. Suicide is now the second cause of preventable death in children starting at age 10. That's true around the country. As the state's co-chair of the Child Fatality Review Panel, I can tell you that we are seeing that in Connecticut as well, as the age of children that both attempt and die by suicide has become younger and younger. And we see deaths of children by suicide in Connecticut as young as 11 and 12 years old in each of the last 3 years. So I wanted to highlight that for you. Our testimony does have the Connecticut suicide data for children for you for your reference. And I'm happy to talk more about that with you. So anything we can do, experts really recommend for suicide prevention, increasing counseling from hospitals to parents about lethal means and environmental protections for their children in the home, but also increasing screening for children who may be at risk for suicidality. We also wanted to highlight, you have a couple of shell bills on about DCF safety, health. I know there'll be a hearing next week, so I'll reserve most of my comments for that, but I'll leave it for today that we do strongly believe that we do strongly recommend that their state create a structure for public progress monitoring of the Child Welfare Agency, as right now we have none. So that'll be my comment, but I could talk more about that next week. Finally, two quick other things, an act concerning the safe storage and disposal of prescription drugs, cannabis, and cannabis products. I think we have a lot of work ahead of us as Connecticut has moved to legalize cannabis products. I think it will be very, very important to keep our eye on children's access to products, particularly as we know there remains, despite prohibitions, products that are marketed as attractive to children. I can tell you that as the chair of the state's Child Fatality Review Panel, we are going to keep it on as a standing monthly agenda item to review critical incidents or hospitalizations of children related to accidental ingestion of cannabis products. I can share with you, as we did in our testimony, that even prior to this, the state Poison Control Center saw a 300+% increase in calls to poison control over the last few years about accidental ingestion of cannabis products. While we have seen no fatalities related to the ingestion of cannabis, the ingestion of cannabis products by children, particularly under the age of 6, will typically require medical attention. Our recommendation to the committee about the bill is perhaps to include in the warning some of the information that the US FDA has also put in an alert to consumers as recently as 6 months ago. And I have that language for you in our testimony, but making sure that consumers know that if they have any concern about accidental ingestion by a child, to call 911 and seek medical attention. So I think that the work that bill is very important to pass and to keep going with. And last bill I wanted to comment on is an act concerning emergency services and individuals with autism spectrum disorder, cognitive impairments, and nonverbal learning disorders. It remains a fact that children with disabilities do disproportionately encounter police in response to behavioral concerns that they may exhibit in school or in the community. The Office of the Child Advocate tracks school-based arrests of children 12 and under around the state. We did an investigation a couple of years ago into the use of police response by Waterbury Public Schools to the crisis behavior of children in grades pre-K through 8. And our testimony includes some of what we found, that in a 6-month period of time, Waterbury, those schools, not the high schools, but the pre-K through 8 schools, called police to respond to the behavior of a child 200 times. The median age of a child subject to a 911 response was 8. Age of children ranged from as young as 4 years old. There were 36 misdemeanor arrests of children as a result of those calls, 90 trips to hospitals, which also costs a fortune to respond to children that way. A review of all 200 police reports showed us that the majority of children that were subject to a 911 response were identified by law enforcement as a child with a disability. Some children were the subject of multiple 911 reports, and the children who were the subject to the most police calls were identified in police reports as children with autism. I included in our testimony some of the examples that come directly from police reports. And if I can, I just wanted to share one of them with you. Police officer was dispatched to school regarding a complaint of a 9-year-old student who was acting out and hitting teachers. Upon my arrival, I spoke with the complainant, who is a special education teacher employed here. Teacher said that her student suffers from autism. She said the child was not listening to directions and she was in crisis. The child was throwing things around the classroom. Teacher said she can be violent. She said that this was the 3rd time the child had become irate in school and that on 2 previous occasions she threatened suicide. She said that the child had banged her head on the wall, causing a bruise on her forehead, and that she had also bit herself on the arms. Teacher said she had called child's mother, but she did not answer, did not call back as of yet. She said she feels mother's not answering because she's tired of coming to the school to pick up her daughter. The officer observed a small bruise in the center of child's forehead and numerous old bruises all over both of her arms. Child was yelling and screaming at times while I was here, and she refused to speak to this officer. Child calmed down, and ambulance placed her on a stretcher without violence, and child was transported to the hospital for evaluation. I raise that as an example of one of the police reports that we saw. It's police job to come when called. So we don't fault that at all. But what we have to do is, I think what the bill is speaking to is a piece of the issue is police will come with the tools and the training and the resources that we have. We did see that a number of children in that Waterbury investigation were handcuffed by police as a way of managing their out of control behavior, including children, very young children under the age of 10 years old. So I think we would all agree that this is not what we want for our kids. I can't say that the Waterbury Police Department and the Waterbury Mayor were very responsive to the findings in that investigation and committed to significant changes to address that. And I think that's really positive. But the issue that the committee's bill raises, which is, how do we support and train first responders to interact with children who are nonverbal, children who may not process communication, who may not respond to directions. That's hard for any first responder. We want to make sure that where police are called, that they know how to respond. And that children are not unduly or additionally traumatized by that encounter. So thank you for raising that bill. I think it's really important, but I also think we have a lot of work to do to make sure that our schools have the tools they need so that they're not relying on 911 to respond to the behavior of very young children with disabilities. Thank you. And I can answer any questions that you may have.
Thank you for your testimony. Representative Dauphiné. Wait, Master, I'm sorry, you were pointing. Representative Mastro Francesco.
Thank you very much, Madam Chair. Thank you very much for your testimony. I appreciate you coming in today. And I apologize. I probably missed the first 2 or 3 minutes of your testimony. So I just had a couple of questions for you, if that's okay. And this one here is actually in reference to Senate Bill number 2.
Okay.
I believe in section 2, it talks about adding the term of sanctuary public library to that language. Can you explain to me what that means?
Sure, I have the bill right here. Thank you. So our testimony, just to be clear, our testimony was focused on the children's mental health provisions of the bill, in particular, the Medicaid reimbursement for suicide screening and the addressing the licensure components to increase the number of licensed social workers that work with children. But I'm happy. So I don't have testimony on all of those other provisions of the bill. But I have the bill in front of me and I'm happy to answer any questions. So sanctuary public library is defined in the bill as a principal public library that makes available and lends any book that has been banned, censored, or challenged by a person, organization, or entity, and any related library materials, and does not prohibit or otherwise limit the availability of any book or related materials by banning, censoring, or challenging such book or related library materials at such library.
Right.
I'd have to think about that one for a second. There's a
Okay.
lot there.
I understand that you're only testifying in that one section. So are based on your testimony, is that the only section in this bill that you support?
So we referenced multiple sections of the bill that speak to children's mental health. We didn't specifically address other provisions of the bill, but I'm happy to review that and get back to you with our view on that. We didn't look at that as necessarily part of, things that fall under the purview of directly under the purview of our office, but I'm happy to provide you our thoughts about additional sections of the bill.
If you wouldn't mind, I have concerns with this part of the language of the bill. And I know you were only testifying on certain sections, so I'm assuming that your department or whatever would support this section. I don't know for sure.
Okay.
So if you can get me clarification on that.
Sure.
The concern I have in here, and I guess you won't be able to answer my question on it, is making the libraries a more of a sanctuary libraries. There's some libraries that ban sexually explicit books that quite honestly could be harmful to children, right? And we're given incentive grants to libraries that actually include those type of books to children. And those can be very harmful to children. And that's why I was questioning you whether or not this is something that you would support.
Yeah, no, I appreciate the question. I mean, in general, right, I would say that we want children to have access to a broad array of materials that are appropriate to them. But I understand the question that you're asking, and I will take a closer look at the language and let you know any thoughts that we have about it.
What it would look like. We're trying to identify eligible children in Husky Health. Is that because possibly the asset limit has changed and so forth, the amount of income that you can make? Why is the state going out seeking and actually identifying people to go on to Husky Health? Through you, Madam Chair, I apologize.
Thank you. So, we're not the author of the bill, but looking at that proposal, I mean, we would support that. I think what it intends to do, Representative, is to make sure, like perhaps through, shall hire temporary and part-time employees responsible for collaborating with nonprofit organizations to identify and enroll children, is to make sure that all children who are otherwise eligible for Husky, that their family knows that they have eligibility, that they're connected to healthcare, to make sure that we don't have children who would otherwise qualify who are under-enrolled. I mean, that's the way I interpret that.
Right. Thank you. I appreciate that answer. And I certainly understand the education process. We have websites out there. We have material in the schools. There's data all over the place to educate people on our Husky program to determine whether or not they are eligible or not. But for the state to go out and actually seek those people, actually in section 18, it talks about allocating $150,000. So for us to actively go out and hire people, to go out and seek people that are eligible for Husky is a concern, because we have all that. We have that information, like I said, in the schools, it's in the town halls. There's so much information out there that is available for people to participate in the Husky plan should they need it. And that was my concern on that. The last question I have for you, and if you wouldn't mind elaborating a little bit on this for me, is that last year we passed a big omnibus bill about children's mental health.
Mm-hmm.
And I'm curious, do we have any data as to how that program is working? What has happened? How is it working? Here we are talking about another children's mental health bill when we don't even have any data on what we passed last year. So we're actually expanding on something. We don't even know if the other one had worked and what happened. Would you have any detailed information based
Yeah.
on your experience of what we have done and what has worked?
Sure, I think that's a great question. If I could just on the last point about the Husky Health, and I appreciate the comment that you're making, I think it would be useful to know, and I'm sure there may be folks in the state who have the data as to what the estimation of under enrollment is. Like what percentage of individuals or children might be eligible for Husky that are not enrolled, because of course there are costs associated with not utilizing or having coverage that would help you access regular care, right? Because I appreciate your concern about putting money into a problem. I think that may not be a problem. So I think it would be helpful to have, if that data is available and DSS may have it, or the Office of the Healthcare Advocate may have it, estimates around how many children and families are not enrolled that could be. So that's just one suggestion I would make in terms of data. Your question, Representative, about we just did a big children's mental health bill. We invested $100 million in a variety of children's mental health programs that I think it is really important to ask about where are we with that. I 100% support that, right? I think there were a number of things that were funded in terms of grants from the State Department of Ed to schools, expansion of school-based health centers, programs funded for DCF, et cetera. I think in some, based on what we know, some of those are fully implemented, some are partially implemented, and some are not implemented, right? So just to give you one example that we've been really sort of involved in following is the legislature appropriated dollars for behavioral health, urgent care centers, and crisis stabilization beds, right? Those are not yet stood up for a variety of reasons. Right. And so that's something we're continuing to really look at because that was a need that was identified. Right. So what are the delays in trying to understand that and when are those going to be implemented? And then, of course, what impact are they going to have for children? So I think it would be important to hear from the state agencies about which of the initiatives that have been, I think most of them are probably not fully implemented yet, such that we would have data about the impact yet for children. But I think the question is really important. And it's really important that we track our investments and how they're reaching children and families and how they're benefiting children. One of the things that we strongly supported last year in 5001 House Bill was the implementation of a new sort of strategic planning oversight body for children's behavioral health that would be required to be data driven in that way to see what investments are being made, how they're helping children and families. And that is in the process, my understanding is, of being stood up at this time. I think that's going to be a really important thing to develop and support so that we have these answers to these questions, in part for policymakers as they have to make investments. So I could go on and on. I mean, I guess the last thing I would say is we know that children continue to present with very significant mental health needs. And we do know that from a building work to do to make sure we have
implemented, some are partially implemented. Would you be able to give me an example, or do you know of any program that was out of the bill that we passed last year that may even be partially implemented? To kind of give me an example of any data or any information or any success or how that is working, even if it's just partially, because when you partially implement a program, I would assume that we're following it through the whole process. And we should know early on whether or not it's working. And if it's not, or if it is, what do we need to tweak? So my question is, can you cite any program in the bill that we passed last year, partially or fully implemented, to give me an example of how it's working? Through you, Madam Chair.
Yes, no, thank you. And I appreciate the question. I'm trying to scroll through last year's Senate Bill 2 and 5001, like all of the programs I can think. I don't have those in front of me, right? I'm sure the answer is yes to some of that, right? And so I'd love to get you more information. But off the top of my head, for example, one of the things that was funded was the expansion of mobile crisis to be a 24-hour program, be available 24 hours a day, 7 days a week. And that is implemented. And that is closely tracked by the performance It's a Performance Improvement Center, Performance Management Center, which is Children's Health, Connecticut Children's Health Development Institute, CHDI, would have a lot of data on that rollout. In response to some of the things you might be interested in, how are people accessing that? They collect a lot of data around that. So that's an example of something that has been implemented already. I know, I'm not sure it was in Senate Bill 2, but one of the new initiatives to address chronic absenteeism through home visiting, which is the LEAP program, has been evaluated and has some good data around the use of home visiting to engage with students and families and to help address chronic absenteeism. Is another program that I think was partially ARPA funded. So it's been implemented a little bit longer. But there are also programs that are not yet fully implemented, as I said.
Right.
But I think there's a number of things in there, and I'd be happy to find more examples for you of things that I think have been implemented and around which there's data, and I can get that back to you.
And thank you. Thank you. And through you, Madam Chair, yeah, I would be really interested in knowing data.
Yeah.
The call center, for example, how many people have called in? How many people have we interacted with?
Absolutely.
How many kids are not going to school? I know that they're implementing, and you may not know the answer to this, and I really don't mean to, and maybe you're not the right person to answer these questions, but I think it's really important that we have data on the bill that was passed last year, exactly how it's working before we go putting in another big bill when we don't even have the data from the previous one. And that was my point. Thank you very much for your testimony. I appreciate it. Again, I don't mean to put you on the spot, and
okay.
I know you don't have all the answers, but I thought that would be a good start. Thank you very much. Thank you, Madam Chair.
Thank you. Can I
Thank
just
you,
say,
Representative.
can I say one final thing to that? First, I'm happy to answer whatever questions you pose and see what else we can get for you and for the committee. On the workforce pieces that we did testify on, there is a lot of information, there is a lot of data around the problem. Right. So, for example, the amount of the licensing fees or the dearth of social workers. So there does, and I completely agree that this has to be data driven around the definition of problem and around the application of appropriate solutions. So to the extent that the bill includes provisions trying to address the dearth of social workers or the delay in licensure or the cost of licensure, I think those things are really important because we do know that those things are a problem. And Connecticut is not in step with some other jurisdictions on how we do that part of our workforce. So some additional thoughts.
Thank you, Representative Mastro Francesco. And we do have someone, I'm sorry. Representative Pizzuto.
Thank you, Madam Chair. Ms. Egan, I just had a couple quick questions on HB 6718. We yesterday in general law, we were talking about issues about packaging and maybe possibly putting things like the poison control number on those packages, or putting, you get a candy bar with 20 pieces, each piece is say 0.5 THC, but gee, 20 pieces, they're talking about blister packs and things like that. But to get down to that level in consumer protection is very difficult. And then the feds don't regulate certain things and they can't supersede the feds. But would you be in favor of things? I mean, I don't know why you wouldn't, but is that an issue why they didn't already put in things like poison control number, telephone numbers, and something as a child advocate?
Yeah, I think having poison control on there would be great. And as the parent of 3 children, including a 4-year-old, I have personally called poison control on a number of occasions, and I can
Sure.
vouch for it being a terrific hotline. They're so knowledgeable.
Great.
So I think that's a great suggestion. And there are things, and we put it in our testimony, the US FDA put out a public alert last June with important information for consumers and had recommendations regarding it. Said it's essential that consumer health materials and warnings referenced are explicit regarding the dangers of accidental ingestion or overdose of cannabis and other substances by children. The warnings may also be amended to include the FDA's recommendations for consumers, which are about calling 911 was bullet 1. Bullet 2 was calling local poison control. If the child has consumed these products, do not wait for symptoms to call. That's what it says in the FDA. And contact your health provider if you have, some language there. So they have 3 bullets that they recommend as part of the alert. And so I think that's worth looking at and talking about with consumer protection. I mean, it's hard to put everything
Sure.
in a warning
Yeah.
label, but what are the main things we want parents
Right,
to know?
right. Okay, and one other question, if I may, through Madam Chair. on HB 6719. That was number 12 on there. Quite often, I used to be on different boards in Waterbury, and my wife taught 37 years, seventh grade, and in the public school system. And the school resource officers often were the first line of defense. And I think we should try to single that out because, you know, we have 300 police officers, but that's not enough. And sometimes to get to a school where you have, not every school has a school resource officer, but to single in on possibly the training as a school advocate, or at least as a point person with whatever training, maybe if someone's on the spectrum, the Asperger syndromes or whatever, they can be that. Now, I don't know how that affects the police that work there and union issues and all that, but is that something, have you ever reached out to school resource officers, not just Waterbury, but anywhere?
So, well, I was going to say in Waterbury, we talked both with, so the younger kids schools don't have SROs.
Right.
Right. So, but we did meet with one of the police officers who goes to the different schools, and we met with the police chief and we met with the mayor, who's the former police chief, about these issues. And they talked about, you know, the need for training and the need for maybe a different model of response that includes, I mean, we're moving to in the adult system, you know, combining a social worker, right?
Mhm.
Having a crisis response that includes a social worker.
Yeah.
Boy, that would be really, really important to do on the children's side, right? And because there's so, I mean, police officers, I mean, the reports we read were very professional, right? But the people come with the tools and the training that they have, and they
Right.
don't have discretion to not come, right? So looking to enhance that training, of course, but also looking to enhance the model to include a behavioral health component. When we looked at all the coding for the calls, right? The calls are
Right.
mostly coded
Yeah.
by dispatch as mental health or medical, right? So what should that then mean on the other side of that response? Well, it
Yeah.
means, you know, we want to move to that more coordinated mental health response.
And years ago, it fell to a guidance counselor, but I've seen schools with 1,500 students and they'd have one guidance counselor.
That's
And so it's just overwhelming, but I
Yeah.
appreciate your answer. Thank you very
Thank
much.
you.
Thank you, Madam Chair.
Thank you, Representative. And we have one more question from Senator Anwar.
Thank you so much, Madam Chair. Thank you, Ms. Egan, for the work that you do and your entire Office of Child Advocate does. I do have a number of questions, and I will speak first on 6718, and I appreciate your testimony. And I'm going to speak to this with the background of the letter that your office shared yesterday. Do you think that an informational hearing that you touched on is something that should be something that we should do on a regular basis? Because in the next, unfortunately, few years, we would have to continue to raise the awareness and make sure as a state, but also as the public who is learning from some of these informational hearings can be better prepared to prevent deaths because of cannabis, opioid, more so opioid related storage issues?
So I'm a big fan of Senator Anwar. Thank you for the questions. I mean, I'm a big proponent of having information available to discuss with policymakers. So that was a big part of our findings letter that you referenced that we sent out yesterday, talking about in part the accidental or the death of very young children from fentanyl intoxication. And as that letter pointed out, we've had over the last 3 years, at least 8 deaths of infants and toddlers from fentanyl overdose. And we have advocated for an informational hearing to discuss that and to discuss how the service system, which is to some extent largely focused on adults, can also be responsive to the needs of children impacted by the opioid epidemic. Because for every adult who's struggling with opioid use disorder and fentanyl use, there may be a child who's part of the household, a child who, but that individual is a caregiver. So we have to be thinking about our public health response to the opioid epidemic in a 2-generational way. And we need to hear from our state agencies, our providers, and from folks with lived experience about what is working in our communities and what isn't. So yes, I think that having opportunities to have regular conversations with policymakers about what we're learning, what we know, and what we can do better is really important. On the cannabis issues, as I said, we will be, I'm sure there are lots of people that are going to be tracking, the various pros and impacts of cannabis access at Department of Public Health, the Department of Children and Families, at the Office of the Child Advocate, Child Fatality Review Panel. And yes, Senator, I think it will be important to come together in structured conversations to talk about how are things going? How do we know? In a variety of ways, right? But certainly from our perspective, the looking at risk of accidental ingestion for young children is something we're focused on. We do have some ideas about data sets that can help inform us about that issue as we move forward through the next year. But definitely important to keep that on our agenda, on our public health agenda with policymakers. So yes.
And thank you so much for your response. On the same note, do you think that perhaps this bill 6718 can legislatively require us to do this on a yearly basis at minimum?
Sure. And you can write, absolutely. And we have frequently recommended bills that that include an informational hearing component to address certain questions.
Okay. And on another bill, Senate Bill 2, and I'll try to put this in context. I know one of my colleagues was asking questions. Is it fair to say that the children's mental health and their well-being is a very complex issue? And just because the title is similar to what may have been suggested or done or passed before does not mean that the details of the bill are exactly the same as the previous year. So I think that was indirectly being suggested perhaps, but I want to make sure that there are multiple different avenues. And when we were working on Senate Bill 2, Senate Bill 1, and House Bill 5001 last year, the conversation was, this is a marathon. We will have a multi-year strategy. And we were starting to put all the things together. And there were things that we wanted to continue to pursue that we had not pursued in the past. So a bill with a similar title does not mean that we are writing the same bill again and again. It means that we are actually looking at the other gaps that we had identified and we are fixing those. It's more for public perspective, but I would like you to reflect on what I'm saying, because I don't want people to think that we're putting the same bills again as was being suggested, because those bills will take a lot of years to be able to show their results. And we will be following them because follow-up on all the avenues were part of the legislation. So the legislation wasn't saying that we're going to put it once and forget about it. The legislation requires us to track those things. So perhaps you can reflect on what I'm saying, if I'm accurate.
Yes, thank you, Senator. And as we've talked with legislators last year, this year, all the time, the mental health care is part of our healthcare system, which I think we all agree is not perfect. And we know that there's lots of children struggling. There's a lot of system building to do. We have a minimum 10 years of intensive work to do to build a system that can provide what we all want: ready access to appropriate services to children and families and adults when they need them. And right now, we still have a system where people, even in crisis, don't go on waiting lists for mental health care. We know that. We see children leave hospitals and be put on waiting lists. We still see children, we were in public health yesterday, yesterday before, talking about children who board in emergency departments, still sometimes for days. I talked recently with Yale New Haven Hospital about a young child, 11, 12 years old, who spent 30 days in the emergency department, right? So we have a lot of work ahead of us. I am nod to the discussion before, we want to go about that in the most data-driven way we can, so that we know we're spending the right money. I frankly think a lot more money is going to be needed, because we have been underfunding mental health care for a long time. Can't have a system where Medicaid and contract rate for services have not changed for years and years. That's not the world. We have to pay for the care we want our children to receive. And some of the other things we've talked about, why do pre-K through 8 schools call the police to respond to a 9-year-old with autism? Because they don't have anybody else in their building to help them, right? So there are layers and layers of this to work on. And I appreciate the legislature's focus on this. I do agree that it will be a multi-year effort.
Thank you so much. Madam Chair, I just wanted to have a couple of more moments. I wanted to just, I think it's worthy for us as legislators to keep this in mind, that it will take many years for the effect of our investment in our children to show the results. And for any legislator or group of legislators to say that they will not support any bill on children's mental health or well-being because we have not seen the data from the results from the previous bills would be a disservice to our children, because it's too early to be able to get all the results back, but their results are going to start to show that we did not get where we were overnight. We got there with a lot of lack of investments and challenges that we had seen. Can I ask about 6719? We have had this brief conversation, Ms. Egan, about some of the children with autism spectrum landing into prison system, and that's not where they belong. That's not a safe place for them, and that's why this bill becomes even more critical to have appropriate training and an appropriate triage, so that we are not sending somebody where things will get worse rather than better.
That's right. That's right. And we know even from the comments that the Department of Correction has made to us over the years that, you know they have a lot of young people with significant disabilities in the correctional system. And as we've talked about with many of you, the correctional system is not a healthcare system. It's not a hospital system. So we have to do everything we can to make sure that young people are getting the treatment and the developmental support. There are a lot of young people with borderline intellectual functioning, other cognitive disorders, who do wind up justice involved. And we see some of that in the report that I just talked to you about. And we can do better than that. And it starts with providing the appropriate care, support, and resources to children wherever they live and wherever they go to school. And I think that that's how we help the most kids and get the most bang for our buck that way.
Thank you so much, Ms. Egan. Thank you, Madam Chair, for allowing me to ask questions. Thank you.
Thank you, Senator. You're good. Seeing no more questions, thank you so much for your testimony. Next, we have Luke Bronin.
Good afternoon, Chair. Thank you so much for the opportunity to testify. Thank you to all of the members of the committee. I appreciate the chance. I am here today to testify on SB2, an act concerning mental, physical, and emotional wellness of children. And first, I just want to commend the General Assembly as a whole for the work that you did last year in passing a significant expansion of funding and accessibility to mental health care for children. I think we have an important opportunity to build on that work. I wanted to highlight 4 areas in particular. I'll speak briefly to these and then look forward to any questions or conversation. I think that the bill that was put together last year did a tremendously important thing in expanding access, and particularly expanding access through our school systems. I think there's an important opportunity to make sure that we continue that work by expanding access to those young people who may be the most disconnected. And that includes, I think, those young people who are engaged by our youth service bureaus. As you know, youth service bureaus are operated directly by one or more municipalities, and they're responsible for planning, evaluation, coordination, and implementation of a network of supports and resources for young people. They were established to address a number of issues, including crime, family crisis, substance abuse, but they also have a critical responsibility for truancy, which was a responsibility that was shifted to youth service bureaus a number of years ago. However, when that responsibility shifted, resources did not follow the responsibility. And as we continue to face both the mental health crisis and an attendance crisis, it's really critical that we look at our youth service bureaus, look at the breadth of their responsibilities, and resource them appropriately to do that work. So I hope that the committee might consider an expansion of support for youth service bureaus. Similarly, juvenile review boards play an important role in diversion and prevention of criminal activity by young people. There's a lot of evidence that shows that early interventions can be effective in reducing and preventing further offenses. DRBs often take a restorative justice approach, and they can make a real difference. But here too, they have very few resources to work with. And so as we look to support those young people who may be in the highest need, I strongly urge the committee to consider including and advocating for greater support to our juvenile review boards. Third, we know that most young people who are involved in criminal activity as young people